Welcome to More Than a Walk podcast featuring UpLift Her. I'm so glad these ladies have decided to join us today on this podcast. The wonderful ladies and presidents of our Divine Nine organization, MPHC. I want to welcome the president of MPHC, Charity Martin King. And tell us a little bit about yourself, Charity.
Hi, Tracy. I currently serve as president of the National Pan-Hellenic Council with these other lovely sorority presidents. And in addition to that, president of my chapter of Zeta Phi Beta Sorority Incorporated, Gamma Zeta Zeta chapter here in Columbus, Ohio.
And I'm also excited to not only welcome my childhood friend, but she is also the president of Sigma Gamma Rho. Ms. Jill Lundy, could you please introduce yourself?
Yes, my name is Jill Lundy. I am the president of Sigma Gamma Rho Sorority Incorporated, Delta Omicron Sigma Alumni Chapter, the Columbus grad chapter. And it is such a pleasure to be here.
Thank you. And I also have, and I'm excited, my bass list, Tracey Bell Thomas. Could you please tell me a little bit about yourself?
Yes, good evening. I am Tracey Bell Thomas, and I serve as Bacillus, or president of Alpha Kappa Alpha Sorority Incorporated, Alpha Sigma Omega chapter here in Columbus.
And finally, we have Tamara Stanley. Staley, did I say it right?
Staley.
Staley, I said it right. I got it right. She is also a longtime friend. A lot of people don't know our history, but we have one, and I love her to life. We got a little side secret going on. But anyway, tell us a little bit about yourself, Miss Tamara.
Good evening. My name is Tamara Staley, and I am the Columbus, Ohio Alumni Chapter President of Delta Sigma Theta Sorority Incorporated.
So ladies, thank you and welcome to our podcast. And today we're here to talk about UpLift Her and what UpLift Her means. And I just want us to sit back on these comfortable couches and in these chairs and kind of talk about what UpLift Her means, what it means to you, and why it is so important for us as women of the Divine Nine to come together in a unified platform on June 22nd, 2023, and work together to make sure that women take care of their health. Who wants to go first and talk about why this is important? Don't make me call you out.
Miss President.
Miss President.
Thank you, Sister Bacillus. I just want to first say that we all are doing so much, whether it is Divine Nine organizations here in the city of Columbus, but across the globe. All of us in some capacity are working together, whether it is serving our young people with the walk, with health initiatives, things that we're doing in schools and supporting scholarships, supporting one another's programs, because literally our intent is to show up not only with our human capital, but our monetary capital and support, because our organizations are so necessary.
Right.
Over the years, we started with a need. There was a need because we couldn't get financial aid. We couldn't get funding to go to colleges and universities. And so we see this birth of the Divine Nine and the umbrella organization of the MPAC in 1930. So I just want to make sure I amplify that, is that we're already doing so much. And so just to add this component of emphasizing women's health on a larger platform, grateful for UpLift Her and the African American Male Wellness Agency for giving us this platform to do it, because we're already doing so much.
Right, and to your point, Charity, the interesting thing is when you think about the history of all of our organizations collectively, I know I can speak for Alpha Kappa Alpha, we have had 115 years of service and sisterhood to our international community and our local communities. And so for each and every one of our organizations, we know what it takes to put that work back into the communities in which we live and our families grow, and we're all friends and, you know, we work and play in. And it's important to ensure that when we are giving back, everyone has that equitable access to care. And it's up to all of our organizations to ensure that we educate the public, we're educating our communities, and we're providing them with those resources so that they can be healthy and strong and live the lives that they so richly deserve, just like everyone else.
Right.
Absolutely.
That's right.
Especially the communities of color.
Right.
That's right.
I was speaking with you just a little earlier. We talked about the Divine Nine. We all wear different colors, but at the same time, we all were founded and based in the same principle. We all want service to better our community, better the lives of women. Uplift Her is really focused on these women of color, and it's so important. It's such a great opportunity. And to have us all here together just really makes it all the more exciting and beneficial to everyone. So I'm excited to be here.
And I would just like to add the Uplift Her initiative is so empowering and so moving, and just allowing us to come together and bond and love and care for one another, and that physical connection, especially coming out of a pandemic that has had such a large impact on the physical and mental well-being, is so important. And I applaud the Uplift Her movement for bringing us together to help educate the community.
So I'm going to say we have dispelled the rumors that, none of those organizations get along, because we're all sitting here on these couches and chairs together. And it's always a joke for us when someone comes to me and they're inquiring about any Divine Nine organization. I'm always asking, well, do you know an AKA? Well, do you know someone who's a Sigma Gamma Rho? Do you know someone who's a Delta or a Zeta? Because we understand that to be a part of anything great, you have to know people in these great spaces. And so I'm so glad that you women are here in this space, and you are great. And as we begin to talk about how we dispel those rumors, we also need to talk about how we dispel the rumors that Black women don't want to be healthy, that we don't want to work out because of our hair, or we're scared to go get mammograms. And some of those things aren't just true for women of color. They're true for all women of colors. There's sometimes I don't want to go work out because my hair is the bomb. But we also want to make sure that we dispel those rumors that we don't want to be healthy, that we don't want to take care of our bodies. And I believe that Uplift Her sets that platform for us to say, hey, listen, our communities of color, we do care. We do want to take care of ourselves. So let's talk about how we dispel those rumors, ladies.
Well, the first thing with that is that I want to be sure that we understand the impact of what the Black community is dealing with. We often say people of color, but we are historically Black Greek letter organizations, and whether it is Black folks or our Latinx community or immigrant communities, displaced communities, that our access to healthcare is not the same.
You're right.
And that's the truth.
That's
That is
the
the
truth.
data.
Right.
Is that regardless of how much money you make, the Black woman and the Black family is getting less access and less quality health care and services. And even when they're communicating with physicians, they may say, I don't feel well, or I feel a pain, and we're less likely to be listened to in the physician-based system.
Right.
So when we think about the type of foods, the processed foods are cheaper, fresh and healthy goods and produce are less accessible and much more expensive in our communities, or even the quality of the meats in some of the grocers in marginalized communities, there's a real issue. And so even within that issue, or these systemic concerns that we have as Black people, our organizations address that in so many ways. Our youth auxiliary groups, when we're having webinars, when we're getting together, working with Uplift Her, attending the walks, or other community partners that we have. And so when we think about the myths concerning us, I really want to make sure that we magnify the data that says that there is something wrong in the system that needs to be addressed.
Exactly.
And whether it is the booths, the educational sessions that are going to happen at this event, it is critical to get the information out to our community.
I agree.
And also, one of the things that we need to understand, and there's a term out there, and it's called social determinants of health, right?
That's right.
So everything, when I talk about it at work, the best way to describe it is like dominoes. You know, when you're playing with dominoes and you're setting them up, and if you knock one over, the rest eventually will fall. So
Right.
if you are born poor, and your mom doesn't have a job, 9 times out of 10, she's couch surfing and living at grandma's or auntie's house with you in a pack and play, not a crib,
That's
in
real
a
talk.
room.
That's
I
true.
mean, this is real talk.
Yeah.
You know, that you're living in communities where there aren't safe spaces for kids to play or seniors
That's
to
right.
walk, or there are food deserts. There's a lack of transportation, and not even the CODA, the bus, will, you know,
Go to
come
the
and pick
city.
you up
Yes,
in your
right.
community to take you to work. So there are, or better yet, as we're talking right now about UpLift Her and access to care, lack of access to care because a lot of clinics and physicians' offices have moved out of our inner city communities.
Yes. Yep.
And they are now in suburban communities, or they are at the hospital systems. And people go ultimately where the money is, right? But we do have a handful, thank goodness, of physicians and health clinics in our communities that are there to take care of our people. But it's just so important to let people know that, you know, we are here. All of our organizations are here to help provide services and supports and education to, you know, give them those resources and share with them, this is how you can get to the doctor's office, and or sit down and have that crucial conversation about going to get a pap smear. How many of us have had pap smears? And it's that negative talk that you have heard maybe over the years from other women who felt it was uncomfortable to them. And so they're impressing upon younger generations that that's going to be uncomfortable for you, when in reality, it's not about being uncomfortable. It's about your health, because you only have one life to live.
That's
so
great.
you have this show, you got to
Say
take
that.
care of it.
Right. Say that.
Right.
I would say, as the resident fitness professional,
Yes.
one of the issues is exposure. And one of the things that I'm excited that UpLift Her will be doing on the 22nd is providing a fitness component, a
Yes.
health and wellness and fitness component for the young people.
Right.
A lot of them do not have the exposure to allow them to work out, so to speak. And there are a lot of myths about it. I'm a competitive bodybuilder, and I'm also a personal trainer. Here's the interesting thing. When I am lean and in competitive shape, people think that, oh, if they work out with me, they're going to look like that. I am 1% of the population.
Right.
And so just because you train with someone or work with someone doesn't mean that you're going to look like that person. So a lot of times there's fear, and that's why I kind of brought that up. The exposure or lack thereof, and then the stereotypes
Right.
that come along with it.
Right.
You know, if you do this, you're going to look like a man. I have never looked like a man.
Okay. Well, no,
And I love
ma'am.
my curves, my lumps, and all of them.
Right.
You know, but, you know, it's just sometimes the exposure. So I'm so excited to see that component
Right.
being offered on the 22nd.
Yes, we are definitely, we did it last year, and this year we're going to up the ante. So we want to really target our youth. And I was talking to someone the other day, and I was saying this about even in our churches, UpLift Her is so significant as you go out to your churches to talk about this, because the church is where a lot of things, unfortunately, in the Black church get stalled, because we don't want to address that sister so-and-so on the front row has been in a situation of unhealthiness for years, but she's faithful to the church, and we're literally watching people in the church die because we don't want to address some of those things that we see in the church. And it's sad. And so one of the things that I think that we need to talk about is how we get that out, you know, and how when we go to our churches, because we all go, and really having those transparent conversations about how unhealthy it is, even in the church, because this is more than a walk. So it's beyond the walk. We got to go where it's beyond, and that's in the churches, and that's in our, you know, our schools, and talking to your friends, and just having those transparent conversations. What do you think, Tamara, about that?
You know, Tracey, you said something about transparency. Well, that's what came to mind, transparency, because the one thing that we don't even do within our families is talk about our backgrounds, our health concerns. You know, we know that we have a lot of disparities in our community that impact our families, whether it's diabetes or hypertension or cancer or cholesterol. And the one thing that we need to start doing is being advocates and teaching each other how to be advocates. And that education piece is so important, that transparency piece, talking with our family, talking to our parents, learning what's in my bloodline, what am I exposed to genetically.
That's so true.
Encouraging people, you know, take someone along to the doctor with you. When I grew up, my mother was a nurse, so health was very important to her, and in turn important for me with the career path that I have chosen. So I really think that advocacy and transparency and having those tough conversations amongst ourselves and within our families, so that we know, what am I genetically up against? What am I going to be looking at down the road that I might need to prepare myself and my family for?
Got to reverse the curse.
Right. And speaking of that, we also have, with UpLift Her this year, our senior component is very, very crucial. And so when I think about my father, who I lost about 4 years ago, my father was a comedian of sorts, but my father was old school from Brantley, Alabama, did not want to be cut on, to the point where when he would have a surgical procedure, and of course I was the child that had to take him, I had to make sure he got there. I would call my mom, make sure dad doesn't eat anything tonight. He has a procedure in the morning. I don't know where your father is. He's not going to listen to me. I would get up to go pick my father up, call him, Dad, where are you at? Oh, I'm up here at White Castles. What do you mean you're at White Castles early in the morning? You have a surgical procedure. I do, like he didn't know. And unfortunately, his unwillingness to comply, to go and get checked out, and it hurts, but I also understand, he just didn't want to be cut on, right? But at the end of the day, I often think, by the time we found out that the prostate cancer had spread, it was too late. But I often think, what if he had gotten that procedure? So then we have to start looking at our parents and our loved ones who are getting older and making sure that we don't miss the mark with them, because we pay attention to the young people, right? But the seniors, so we have a huge senior component this year. And so let's just talk about how our organizations can even tap into that area.
I think that a distrust in the healthcare system is a real thing.
Yes.
When we think about the Black community. And oftentimes, if I stir a little bit of this and I cook a little bit of that and you drink it and you'll be okay. And there's things that we've passed down over time.
Castor oil. Right.
Knock it out with some castor.
But there's just stuff that we have passed down, but there are reasons for that. And then I don't think we pay enough attention to organically grown foods. My mother gardened, and so did my grandmother, and so did my mother's mother. I'm gardening. And it's just a real thing. What's going to be important is whether it is in churches, and I do think we have a lot of clergy who are doing some good things in a health space, and taking their congregations and having fitness programs and fitness rooms and programs in their congregations and ministries. But we need to talk about who's a good health provider that you go to, who listens well, and we don't share that information enough. You're going to a dentist, who do you prefer that's giving good care?
Right.
We should share those tips, because if we're not sharing that, we trust people who we know. If Jill said, check out this person, I'm going to check out that person. So we need to talk about it more, I think. Because not everyone serves this one. There's a reason why we do what we do, but we do need to talk about it more and normalize that conversation, and not only about physical health, but mental and emotional wellness. We have to talk about that. Suicide rates among Black people have gone up. Rates of depression and anxiety are up. And we need to normalize the conversation.
Well, we have to normalize the conversation, but also when we're talking about senior citizens, and also because I've been dealing with the 87-year-old man from Gurdon, Arkansas, so you know your tribe. But it is that educational piece in having those crucial conversations with your parents that you never in a million years thought you would have to have.
Right.
But getting them to understand the level of importance of going to the doctor and how important they are to you and how important their lives are to you, because as we are aging now, you're seeing more and more people who are living longer lives. And then the other piece is cultural competency. There's the need for the practitioners and their frontline staff to be culturally competent when they are dealing with minority populations, because our culture and the Latinx culture, and the Asian American culture, they're all different.
Right.
And so we need to be open and embrace everyone's differences and learn how to communicate. And then the one thing that I notice, at least with my father, is that when he goes to the doctor, a lot of his physicians are other minority physicians. So it is hard for him to understand somewhat of what they're saying. So, they need to, realize as well, you're dealing with maybe also a little bit of a language barrier.
And I think,
also in comprehension.
I think this conversation really has been encouraging for me. And I'm hoping that this conversation, as it goes out and it reaches the masses, that is encouraging for others to understand not only do we have health disparities, but the ladies of the Divine Nine organizations have come together to address those, and uplifting her and uplifting each other as we move forward. I like to thank each and every one of you for your time. You've hung out with me all day today. You got some beautiful
Tracey.
photos. And so we're really excited about what this Unity Week is going to bring. And so as we sign off tonight, I would like to thank you. My bachelor's Tracey Bell Thomas from Alpha Kappa Alpha Sorority Incorporated, Alpha Sigma Omega Chapter. My childhood friend Jill Lundy from Sigma Gamma Rho. My girl Charity Martin King, Zeta Phi Beta. I just love you so much. And of course, my dear friend Tamara Staley, Delta Sigma Theta, Columbus, Ohio chapter. And so as we sign off tonight, know that we all stand together in unity to close the gap on women's health. We will be back, and we are here, and we're standing strong. And if you need anything, reach out to one of us, because we're here to help. We all have health initiatives that will target each and every one of your issues. So tonight, as we sign off, we want to know that we love you. We have Divine Nine love for you. And yes, we all are beautiful, and yes, we all do get along. So don't think we don't. So you can't talk about none of my sisters on this couch, all right? Just know that. And you know what? Just have a wonderful day, a wonderful time. And like I said, please join us at St. Charles Preparatory Academy on June 22nd, 2023 from 3 to 8 p.m. Uplift Her. We will be there, and we want you to come and join us too. Good night.
Yes.
Good night.
Bye.
Yes. Yes.